Good day. I would like to present a report entitled Main Factors of High Effectiveness in Systemic Scenar Therapy. The reason for this effectiveness will become clear as we consider its theoretical basis and a series of clinical observations. Let us begin with the fact that optimum functioning of the body is ensured within a rather narrow range of internal parameters. The external environment acts upon and modifies these parameters. The body strives to compensate for these changes to return itself to an optimal state of being. This is the process of homeostasis, which is realized through the formation of adaptive responses in the body as a result of the activity of its functional and adaptive systems. Deviations in the work of these systems give rise to various diseases and conditions which manifest as diverse complaints. Conventional and holistic system medicines have a various approach to the process of treating diseases. Conventional medicine mainly fights against a disease, while holistic medicine tries to harmonize the human body with the surrounding world. At the intersection of these two therapeutic approaches, scanner therapy emerged as a unique medical technology. As one of scanner therapy's founders, Yuri Garfinkel, said, "We should assist our body help itself, and the patient's own body is the core element of scanner technology." Scanner therapy is a medical technology in which the treatment protocol, where, when, and how much to stimulate, is largely determined by the patient's own body. Throughout its existence, scanner therapy has demonstrated high effectiveness in treating various diseases and conditions. This technology is applied across different fields of medicine, from acute conditions and intensive care to exacerbations of chronic issues. It is used both as a primary therapy and as a supportive treatment, as well as in combination with other methods within comprehensive patient care. I would like to present you several clinical outcomes. Case number 1. A boy aged 1 year and 7 months, diagnosed with complete lysis of the humeral head. After a course of scanner monotherapy, a total of 20 procedures, without any other interventions, his body initiated restorative processes. The results show a complete restoration, not only of function, but also of tissue structure. In other words, we were able to help his body achieve full recovery. This boy, now nearly 30 years old, is unaware that he has ever meant to be disabled. Formal medical assessment had classified him as having a disability, which was successfully corrected 2 years later. Case number 2. Our colleague, Dr. Konstantin Nikitin, was treating a patient with a herniated disc. Here are some X-ray images showing the herniation. After 4 to 5 courses of scanner therapy, we can see a remarkable restoration of the disc's anatomy. This was achieved without the surgery that was strongly advised to the patient back then. The disc fully repaired itself and reabsorbed the herniation. Here you can see the pictures taken before and after therapy. This woman's issues were resolved within 7 months. Importantly, she didn't just receive therapy, she also followed the doctor's advice to change her daily habits. As you can see, this is reflected in her transformed physique post-treatment. She became noticeably slimmer and lost her weight. Let me share another remarkable outcome from our colleague Dr. Vladislav Lyman. He treated a patient with severe 4th-degree frostbite of the foot, a condition where amputation was the anticipated outcome. Thanks to the therapy, they managed to save the foot entirely. The only loss was half of the big toe. The rest of the foot was preserved and fully restored. So, why is scanner therapy so highly effective? I would like to highlight 3 main components. First, special engineering solutions, philosophical concept, and unique medical approach. Let us begin with the special engineering solutions. First, the electrical stimuli applied to the patient's body have optimally selected physiological parameters. Second, A feedback mechanism is employed, meaning the parameters of these impulses are dynamically adjusted based on the body's response. And third, a multi-level patient safety system is in place to prevent any harmful effects. Let's now consider the specific features of the Scenar impulse. Its characteristics are similar to those of an impulse generated by a nerve fiber. It is recognizable by the body, which leads to the activation of regulatory peptide production and a prolongation of Scenar therapy's effects. Here, on the oscilloscope, you can see the Scenar impulse alongside an impulse from a specific type of nerve cell. As you can see, they are quite similar. The main features of the Scenar device impulse are as follows. First, its physiological nature. The neural-like waveform is correctly perceived by the body, causes no undesirable side effects, and readily travels along energy informational pathways. Second, the impulse is bipolar, meaning the alternating current does not induce tissue polarization. Third, the presence of pauses between impulses allows nerve fibers to relax and recover. This non-damaging action is achieved due to the short pause duration, ranging from 10 to 500 microseconds, with a typical average range of 20 to 200 microseconds. Another main feature of the impulse is its dynamism and asymmetry. Both the waveform and amplitude are variable, which significantly reduces the process of adaptation or habituation. Now, let's examine the diagram, dynamic interaction between the Scenar device and the patient's body. The device has electrodes. They produce an effect by generating the Scenar impulse onto the skin, which contains a neural network that perceives this stimulation and initiates information flow to the regulatory centers, namely the central and autonomic nervous systems. Here, this information is processed and an outgoing command is sent from the center to the periphery, manifesting as a change in electrodermal impedance, or skin resistance. And in response to this change in impedance, the device alters the characteristics of the next impulse. As you can see, an initial impulse is followed by a significantly different subsequent one. This new impulse is then fed back into the system, triggering the same chain of events as its predecessor. This cycle continues for as long as the body is capable of change. When, over the course of 1 second, the impulses are perceived as virtually identical, with less than 1% of variation, the device generates a signal indicating that further stimulation with these parameters should cease. At this point, the practitioner must either adjust the treatment parameters for that area, since the body is no longer responding dynamically, move to a different location, or conclude the session. The decision depends entirely on the stage of the procedure. Now let's talk about the philosophical concept of Scenar therapy. It is a distinct perspective, or rather a system of views on the external world, on the concepts of health and disease, on the unity and interaction of organs and systems within a holistic organism, and on the body as an integral part of the environment. In the healing process, the patient is an active and full participant, modifying their lifestyle and mindset to solidify the achieved results. The principles of the therapeutic process in Scenar therapy are, in essence, a reflection of the laws of the universe. Now, if we examine the concepts of disease and health from a philosophical standpoint, we can see the following. Given the same stimulus and identical initial conditions, the outcome depends on how adaptive processes unfold within the body. We can distinguish an adequate adaptive response, a state of self-regulation, which we call health. If an irritant acts upon the body, in which some processes are not functioning adequately, and the transition from one healthy state to another is prolonged, a transitional sensation emerges, which we call a complaint. This inadequate adaptive response represents a transition of health through disease. If an irritant impacts the body that lacks the capacity to fully complete the adaptive response, transitional processes are inhibited, leading to the formation of a chronic condition. Thus, speaking of inadequate adaptive response, if conventional medicine claims to be fighting the disease, it logically follows that it is, in fact, fighting the body itself. Furthermore, a chronic process can develop not only due to the patient's inadequate lifestyle, but also as a result of inadequate treatment. Treatment that fails to assist the body in addressing the cause of the illness and instead primarily works with its consequences. Now let's turn to the main therapeutic principles of the Scenar approach, focusing on the complaint here and now, zone and vector or direction of treatment, asymmetry and small asymmetry, dynamism and stability, opposition and cyclicality, combination and alternation, and economy and optimality. When we use these principles, they help shape the therapeutic triangle and Scenar treatment algorithm, ensuring effectiveness of the Scenar technology. And finally, let's talk about the patient-oriented medical approach. The patient-oriented medical approach is a treatment process structured as a dialogue based on the principle of feedback. For treatment strategy and tactics, the crucial element is not the diagnosis, which does not always reflect the true cause of the illness, but rather the active complaint here and now. That is, the maximum subjective discomfort that exists at the time of the procedure. This discomfort can be characterized by its location, intensity, duration, and the nature of the pain or other subjective sensations. There could be complaints other than pain alone. The primary task of the Scenar expert is to choose the optimal tactics for working with the patient by creating the therapeutic triangle, or forming the interaction system of operator, device, and the patient. Let's talk about the therapeutic triangle. It consists of three core components: the patient's body, the impact device, and the operator, or the specialist, who operates the device and interacts with the patient. Each side of the triangle holds its own significance. The interaction between the patient and the device helps the body alter a multitude of its internal parameters. This constitutes multi-parametric feedback. When we consider the interaction between the specialist and the patient, there is an objective and subjective feedback loop, a dialogue that allows for real-time adjustments to the treatment. The interaction between the device and the specialist involves controlling the device, which is another form of feedback. As needed, the operator can modify the methods and parameters of the stimulation to enhance the therapeutic effectiveness. Thus, the triangle establishes multifaceted feedback, which amplifies the overall therapeutic effect. The treatment algorithm includes three stages. First is the treatment of the designated skin area. The objective is to assess the state of this area and identify asymmetrical zones that exhibit different reactions to identical Scenar stimulation. Second is the selection from asymmetric skin zones of the one with the smallest area and maximum intensity of manifestations, which we call the small asymmetry zone, for additional therapeutic Scenar effect. And third is the stimulation of the selected small asymmetry zone until the planned changes in the skin and complaints are achieved. That is, the procedure does not have strict time limits. Our goal is rather to obtain the planned result, which serves as the signal to conclude the session. The objective of a Scenar procedure is to concentrate the primary therapeutic effect on a small area to create a vector of the body's response and achieve positive dynamics in the patient's complaints. The patient's operation tactics depends on that condition, acute or chronic, which facilitates the patient's complaints. If the condition is acute, then the main operating mode is a subjectively dosed mode, or SDM. In this mode, the dosing is determined by the subjective sensations of either the operator or the patient, with the goal of achieving maximal positive dynamics in symptoms and accelerating the recovery of functional and organic impairments. Supplementary operating mode is an individually dosed mode, or IDM, which is used if no sufficient effect from SDM is achieved, and to enhance Scenar therapy effect due to alternation of various stimulation modes. In a chronic condition resulting from an incomplete adaptive response, the body may cease to perceive its complaints as a problem and begin to treat them as a new fake normal condition. That is, the chronicity of a problem involves forming a different stereotype of perceiving one's own state. The primary objectives of Scenar therapy in a chronic process are to help the patient's body shift its perception of the chronic state from being accepted as a fake norm, to restore the adaptive mechanisms to the level of physiological norm, and to complete the adaptive reorganization, thereby enabling the body to resolve the underlying issue. In case of exacerbation of a chronic condition, the main mode of operation is individually dosed mode. The objective is to help the body make adaptive changes and achieve positive dynamics in the complaints. Here, the additional operating mode is SDM. It is applied to produce additional effect in a local area and to enhance the Scenar therapy effect due to combination and alteration of various stimulation modes. And the individual approach is crucial as it significantly enhances the effectiveness of the operator-device-patient system. The operator's function within the system is to monitor its performance. That is, the operator conducts the therapeutic process, observes its results, and monitors the responses from the regulatory systems, nervous system, both central and autonomic, immune system, hormonal system, as well as psycho-emotional responses. The operator must also take timely adjustments to the therapy. Each treatment outcome dictates the choice of an individual protocol, determining the specific zones, modes, and parameters of stimulation, as well as the duration, frequency, and number of treatment sessions. The therapeutic process is highly individualized for every patient. The role of the Scenar device within the device-patient system is to produce the therapeutic effect, display feedback parameters during the procedure, and assist the operator in monitoring and adjusting the treatment process. Within the system, the device works together with the patient's body as a unified whole, providing real-time correction of the patient's condition. Finally, the patient's role in this system is attentive and active observation of the dynamics of their own complaints and well-being during treatment. Also, adherence to the specialist's recommendations and appropriate lifestyle modifications. The patient's body gradually learns to function correctly in accordance with the situation and within the limits of its adaptive capacity. Thus, we can draw the following conclusions. Disease is rooted in the disruption of homeostasis. The primary objective of systemic Scenar therapy is to restore and normalize the body's adaptive functions and to initiate sonogenesis, the process of self-healing. At the intersection of holistic and conventional medicine, a unique medical technology has emerged. It provides an explanation that integrates novel technical solutions with the philosophical concept of harmonizing an individual as a unified system, as a person, rather than merely treating a disease they were diagnosed with. So, systemic Scenar therapy is essentially aimed at normalizing the functions of the adaptive systems. The high therapeutic effectiveness of systemic Scenar therapy is achieved due to the specific features of electrical stimulation embedded in the Scenar device, the application of a methodology that accounts for the body's physiological and energetic capabilities, The formation of the therapeutic triangle, the treatment system of operator-device-patient, where each element is an active team member working towards a common outcome, and the high effectiveness of Scenar therapy is the result of adhering to a fundamental medical principle, treating the patient, not the disease. Here are a few more examples where we were able to help patients in severe cases. One case, also treated by Vladislav Vyman, involved a limb fracture that had failed to heal for 2 years. The scars from Elizarov apparatus pins are visible here. Osteomyelitis had caused necrosis and resorption of a portion of the bone. Conventional medicine had delivered a verdict: the leg requires amputation. After Scenar therapy, we can see that the non-union fracture, the pseudoarthrosis, has consolidated. The patient is now standing on the very leg that was slated for surgery. The next case is a left ovarian cyst in a 4-year-old girl, which conventional medicine also recommended for surgical removal. However, after a course of Scenar therapy, the cyst transformed into a multifollicular ovary. In other words, the body eliminated a structure it had initially formed as a specific adaptive response. This response was triggered by the patient's elevated level of the female hormone estradiol, which was 2.5 times above the norm. Following the treatment course, the estradiol level returned to the lower limit of the normal range. As this adaptive reaction became unnecessary, the patient's body resorbed the cyst and restored both the structure and function of the ovary. Here is a case of an ovarian cyst in an adult woman. This treatment was managed by our colleague in Turkey. Following therapy, the cyst resolved. Another patient of mine had an official diagnosis of 3rd to 4th degree adenomyosis and had been struggling with infertility for 10 years. An in vitro fertilization center had refused her treatment due to the severity of her condition. The patient then turned to Scenar therapy. We conducted 3 courses of therapy over 10 months. The result was a natural pregnancy and an uncomplicated vaginal delivery achieved without any additional medical interventions. Here is another example, a case of scoliosis in a girl. After a course of treatment and a follow-up 6 months later, you can see the spine transformed into a much straighter structure. Another X-ray was taken 6 months after that. It is a very interesting case. On February 26, she had an X-ray. She was preparing for the next course of Scenar therapy, and they decided to get a baseline image for prevention. You can see that the spine had curved in the opposite direction. The X-ray was taken on the 26th. On the 27th, the girl developed abdominal pain. On the 28th, she underwent surgery for appendicitis. This indicates that the body was already preparing and forming a protective response to an event that would occur 1 to 2 days later, the surgery. Subsequently, starting March 3rd, we treated the girl primarily for adhesion prevention and to promote faster formation of a normal post-operative scar. As you can see, the spine regained a clear, aligned structure. The diagnosis of scoliosis was removed, and the girl now lives a normal life. This brings me to the end of my report. Thank you for listening.